I'm here now to talk about a positive coronavirus test. I had a patient that we recently tested no more than 48 hours ago who actually have a positive coronavirus test. Here shows the testing doctor, which is myself, Dr. Allen. Here shows what a negative test would look like, non-detected, and a detected COVID-19 test, which is detected as a critical value. This patient now will be brought in and to be talked to regarding her test. Here is the CDC criteria for reporting the test to the CDC, of which when there's a positive test that comes, we are required to report that to the CDC in order for their data count, but it also shows we're in compliance of how we should be testing individuals. This patient happens to be a healthcare worker. I want you to know how difficult it is for me to tell this lady that she's positive for the coronavirus. Hey, how you doing? I inform you that you actually tested positive for the coronavirus. And if I'm not mistaken, you are a healthcare worker, is that correct?
Right.
Okay. What do you actually do?
I work for an outpatient behavioral health program.
Okay. All right, sounds good. Are you RN or a registered nurse?
No. I'm just, I run their billing and transportation department.
Okay. So they asked this question here, which is communication and contact with others. Here we go. All right. And that's for the CDC. Now the way it goes is I have to report this finding to the CDC, and what they're going to do, they're going to contact you, and this is how you do it.
So that means I do have it?
It means you do have it. Yeah. As it so right here it shows detected, critical, and if we've identified that that's you, here's the detection, and of course testing doctor is myself, and so at this particular point, you've been tested positive for COVID-19, which is the coronavirus. So what we're going to do now is you have to, anybody else sick in the house at all? But that's important. You're going to self-quarantine yourself, let the family know. The CDC will be contacting you because, of course, now you're one of the numbers that have counted as a positive test in the Los Angeles area. I'm going to make sure you get a copy of this, and they're going to contact you. You got to stay in the house until someone contacts you. They have a 24-hour line, so they should probably be calling you at least tonight or tomorrow morning to make sure that if necessary, the other household members get tested.
Okay. But that's weird. I don't feel sick or anything anymore.
Right. That's the unfortunate thing behind it. That's a good thing, though. That's a good thing that you don't continue to have the symptoms. But when we tested you at that particular point, you had all the indication, and clearly enough, it shows up that you do have it.
Okay, and are they sure that's me? Like,
But that
is my address.
That's your name, right?
Right.
I know. And they called us to let us know because this was as of Wednesday when we did the test. With less than 48 hours is when they called us and told us that you were positive. So you got to stay in the household. Any questions now?
I mean, what do I do for my kids and my husband? And I mean,
If they're asymptomatic, then we're still good. If they've been coughing, okay. If they're asymptomatic, they're still good. Again, the CDC is going to call you and let you know what to do. But we need to keep everybody in our quarantine within the household structure until they reach out to you.
so that means I can't be around my kids, or?
At this particular point, I would try to avoid as much contact with the other family members because we just got this information. Until somebody reaches out from the CDC, try your best to stay away from contacting or getting another person potentially infected with the virus.
So, but how do I do that? My kids and my husband and my mother.
Just for the next, I would say for the next 24 hours, it's kind of hard to say how to stay away from your loved ones.
Right.
However, I would notify them that between now and the next 24 hours, that the CDC is going to be contacting you. My number one thing is if you're getting better, then it's a high possibility that you'll be one of the ones that do well with the illness. But I don't know because I haven't evaluated the other kids. And if they're asymptomatic, then that's a good thing. Right now, there's no treatment for the coronavirus. It's just symptomatic, which means if you're coughing or fever, or, Tylenol, motion.
I'm just coughing like here and there, but not like a cough like every single 10, 15, 20 minutes. I cough like here and there.
Not like it when you first came.
Oh, no.
The job though, the job now. You haven't been back to the job?
No.
Okay. I probably need to give you another note, so you'll be able to let the job know that you tested positive for the COVID-19. I think that was one of the concerns as well as a healthcare worker, that it could have been from that particular location. Now, I'm here to answer any questions. I know this is not the best news, for sure. Yeah, and I hate to be the one to be the barrier. I think you're taking it real well.
I'm just a little confused on so now what happens?
What the next step is the first quarantine yourself, and then of course, which means keep yourself and the family within the confines of the house. Then after that, of course, again, someone's going to call you from the CDC from the hotline to tell you what are their guidelines after you tested positive.
And I mean, it's just scary, but what can I do? And how do I know if it goes away or what?
And from that standpoint, I think we'll leave the other instructions to those guys who are the professionals on that side, which is the screening and testing side. That I'm not sure if there's another potential test to see if it's gone or not, because at this particular point in time, we've had no real cure. It's difficult for me to say what the next step will be after we confirm the test and after we pass it over to them.
And then I can get retested to see if I have it or not, or.
But it's confirmed, and I'm gonna give you a copy. So this test it tells you that it went through, and this is a laboratory they use, which is called LabCorp. Now remember, I'm gonna give you a copy of this yourself. This is a laboratory they use, and it shows all the confirmations.
So just wait at home, wait for somebody to call.
Yes. We're gonna call them and notify. I first wanted to notify you, and then I'm immediately now notify them as well. I'm gonna give you all the information that I have here for yourself, and then all the information I'm gonna turn in to them, which is what we turn into the CDC, that I turn into them as well, so that you have what they have.